You know that moment. You're sitting in one of those hard waiting room chairs, metal or fiberglass, maybe a thin cushion if you're lucky. The fluorescent lights are humming. Someone across the room has been called back twice already, and you've been there for what, 2 hours now? And you think, how busy can this place possibly be? I'm Arnold Facklem. I'm a nurse practitioner with nearly 18 years of experience in hospital medicine, critical care, and the emergency room. But before I ever wrote a prescription or managed a complex admission, I was at the bedside as a trauma nurse, a pediatric and general ER nurse, a pediatric critical care transport nurse, and a flight nurse. I've seen the emergency room from just about every angle there is. I created Beyond the Stethoscope because I believe people deserve to understand what's happening to them and around them when they're in a healthcare setting. And today, I want to pull back the curtain on one of the most universal frustrations in American healthcare. Why does the ER take so long? Here's the first thing I want you to understand. The emergency room is not a waiting room in the traditional sense. It's not a line at the DMV where everyone is there for the same reason and they just work through the list. Think of it more like an airport, except every single plane has a different destination, a different number of passengers, and a different mechanical situation. And some of those planes are on fire. That's triage. When you arrive at the ER, a nurse is making a rapid decision about urgency, not about how much pain you're in, though that matters, but about how dangerous your situation might be right now. The person who walked in looking calm could be having a heart attack. The person writhing in pain might have a kidney stone that, while agonizing, is not immediately life threatening. It's not personal, it's clinical prioritization, and it happens in seconds. I made those calls as an ER nurse. You're reading faces, watching how someone walks in, listening to their breathing before they've even told you why they're there. It's part instinct, part training, and entirely focused on one thing: who needs help right now? Now, let's say you've been triaged. You've got your wristband, you're back in a room, and you're thinking, okay, now we're moving, except nobody comes for 20 minutes. Here's what's actually happening behind that curtain. Orders are being placed, lab work is being drawn. That blood has to travel to a laboratory, get processed, get analyzed, and get reported back. And depending on what they're looking for, that can take anywhere from 45 minutes to several hours. Imaging, x rays, CT scans, those have to be ordered, performed, and then read by a radiologist who may be interpreting dozens of studies at the same time from multiple facilities. And while all of that is in motion, your care team is managing 6, 8, sometimes 10 other patients simultaneously, each with their own labs, their own imaging, their own families, their own complications. The ER isn't slow because people aren't working. Most days, it's the opposite. Everyone is moving constantly. You just can't see it from your room. There's something else I want you to know, something that doesn't get talked about enough. The emergency room was designed for emergencies, but over the past 2 decades, it has become the safety net for everything our healthcare system hasn't been able to catch elsewhere. People who can't get a doctor's appointment for 3 weeks, people without primary care, people who woke up at 2 in the morning and had nowhere else to turn. That's not a criticism, that's reality. And it means that on any given day, the ER is absorbing a volume of need that it was never originally built to handle. I saw this as a bedside nurse, and I see it now as a practitioner. The faces change, the pressure doesn't. The nurses, the doctors, the techs, they're not moving slowly. They're carrying more than most people ever see. So the next time you find yourself in that waiting room, watching the clock, wondering what on earth is taking so long, know this: someone in that building is looking at your labs. Someone is comparing your EKG to the one from 3 years ago. Someone is on the phone with a specialist talking about you. The waiting isn't emptiness. Most of the time, it's invisible momentum. And that matters, and because the goal isn't to get you out quickly. The goal is to get you out right. I'm Arnold Facklem, and this is Beyond the Stethoscope, where we take the complicated world of healthcare and translate it into something you can actually use. If this helped you, share it with someone who's ever sat in that waiting room and wondered. And if there's a topic you want us to cover, something that confused you, scared you, or that you just wish someone had explained, reach out to us through Beyond the Stethoscope. See you next time.